Multiple sclerosis, or MS, is the most common non-traumatic neurological disorder amongst young adults. It affects approximately 85,000 people in the UK. However, as yet, there is sadly no cure, although there is an increasing range of treatments available for sufferers. To talk to me about the condition and those options, I'm joined by Dr. Hilary Jones. Okay, so first of all then, what is MS?
MS is a condition where there's inflammation of the covering sheaths of the nerves that transmit messages from the brain to the rest of the body. And consequently, those messages are interrupted, causing symptoms as varied as visual loss, numbness and pins and needles in the arms or legs or face, slurred speech sometimes, problems with bowel or bladder control. But no two people are alike, so symptoms can be very varied.
So what sort of people are affected by MS?
Well, MS affects about 85,000 people in all in the UK, perhaps more in Scotland than in the south, for geographical reasons which are not fully understood. But women are more affected than men, perhaps 2 or 3 times as much as men are. And it's a diagnosis which is often reached between the age of 20 and 50. So this affects young people, people in the prime of their life, people with young families, sometimes breadwinners, main providers for the family. And the diagnosis can be devastating for those people who face an uncertain future. And I think part of the support that we want to give people is to get them through that difficult diagnosis and allow them to face the future with a positive approach.
So if someone's concerned about MS, what can they do?
I think initially find out as much as you can about the condition to remain empowered and positive. Talk to your GP, certainly. Talk to your MS specialist neurologist, talk to the MS specialist nurses, and I think if you're informed, you feel much better about the future because you're in control.
And are there any treatments for MS?
There are lots of medications which we can use to alleviate symptoms. I'm talking about the control of bladder weakness, of bowel problems, easing muscle spasm, which can be a complication of nerve and muscle damage. We have those available now. We can treat people in various ways for fatigue and depression, which can accompany MS. But more importantly now, we have disease-modifying medications such as the beta interferons and Tysabri, which we know can prevent relapses in certain patients and delay progression of disease. So I think for the future that's a really positive step. And for those people who've been previously diagnosed, who haven't perhaps seen their doctor for a while, it may be a good time to go back and have a talk with your doctor to talk about whether these medications could be suitable for them.
Okay. Well, to find out what it's like to be diagnosed with MS, I met up with MacFarlane, Chief Executive of the MS Trust.
Imagine that you're in your 20s or early 30s. You're just setting out on your career, facing some of the really big challenges in life, getting into important relationships, perhaps thinking about having a family, getting a mortgage and so on. And then you're diagnosed with an incurable condition which is unpredictable. No one can tell you how your disease will affect you, but it affects not only yourself but also your friends and family. And you start to think, will I be reliant on them in order to lead my life in the future? Will I even have to get carers to help me? And that's where it's really important to talk about these fears and worries with specialist support organisations and also people like your GP, and make sure that you get the best help to enable you to live your life to the full.
Obviously a very difficult time for sufferers and their families. Where can people go to get more information?
Well, luckily people are spoilt for choice. We have the MS Trust, there's the MS Society and MSRC, all of whom provide information and a great deal of practical support.
Dr. Hilary Jones, thank you very much.
Pleasure.